Building a better Bay Area. Moving forward, finding solutions. This is ABC 7 News.
Hi there, I'm Kristen Z. You're watching Getting Answers live on ABC 7, Hulu Live, and wherever you stream. We ask experts your questions every day at 3 to get answers for you in real time. Today, we'll look at the annual Holiday Heroes event that helps families across the Bay Area. It's back in person at Oracle Park this year. But first, President Biden laid out his plan to slow down the Omicron variant and COVID-19 in general for the winter season. Is it enough? Joining us now to talk about this is ABC 7 News special correspondent Dr. Alok Patel. Dr. Patel, good to see you.
Kristen, it's good to see you as well.
So with today's big announcement of the plan and a lot of new information about Omicron, we are ready to start with two truths and a lie.
And I try to dial it up to stump you because you're way too well read of an anchor, but we'll see. We'll see.
Flattery will get you everywhere, but I will need my Facebook viewers' help. All right, let's do this.
So I've been told. All right, so everyone knows how this goes. Tell me which one of these is not true. Is it A, in naming, we're referring to the variant, the World Health Organization skipped over nu and C to Omicron, the 15th letter of the Greek alphabet? Or is it B, Omicron has at least 32 mutations on its spike protein, whereas Delta has 19? Or is it C, the second reported case in the U.S. is in a fully vaccinated adult from Minnesota who recently traveled to New York City? Which one of these is not true?
You are very, very tricky. So, folks, let's get to work here on Facebook Live. I will rule out A because I know WHO did skip over new and she. New because it sounds too much like N-E-W, new. So it is confusing to people. And she because it is the last name, surname of Chinese President Xi Jinping, and they did not want politics to be a part of this or any association, so they went to Omicron. Am I right?
Goodness. I mean, I'm just going to take off my mic and walk away.
All right. No, don't. Stay. Okay, so A is not true. I'm sorry, it is true. B, Omicron has 32 mutations on a spike protein. Yes, it does, but I don't know if Delta has 19. So that's why I'm not going to rule it out just yet. So, folks, if you know how many, mutations on the spike protein for Delta, let me know on Facebook Live. Gregory says 9. Okay.
That's literally code for, hey, viewers, please Google this. So
yeah. Hey, we have smart viewers and they know how to make use of Google. Okay. C, the second reported case in the U.S. is in a fully vaccinated adult from Minnesota who recently traveled to New York City. I do believe that is true. I know it's Minnesota. I know it's an adult. I know it's a man. I know they went to New York City for a conference, and I know that New York's governor is now telling everyone who had been at that conference to also get a test and take precautions. So let's go with B. B is the lie.
And Kristen had her Wheaties and coffee today because B is, in fact, the lie. And you mentioned earlier why A is true. C is also, it was an anime convention. And, this just goes to show you this individual did not have a history of, or so we know, about traveling anywhere, any of the other 23 or so countries where this is being reported. So it's possible that it's now circulating throughout the United States. B is important because this is what a lot of the discussion's coming down on in terms of what the Omicron variant is going to be able to do or not do, is that spike protein, which is what our antibodies are recognizing. There's 32 mutations there. Delta has 9. This doesn't necessarily tell us everything, though, because the Delta variant also had mutations in its reproductive kind of genes, like how quickly it could reproduce, its fitness as a virus. So we definitely need more data, but this is why it kind of raised alarm bells.
All right, Dr. Patel, now that my viewers and I have beaten you at your own game once again. No, those were great questions. Thank you so much. We do learn so much doing that. By the way, 90% of our viewers were right. So
our viewers are pretty savvy. Right?
So next round, I hope it's a little harder. But right now, let's talk about President Biden's announcement today, laying out his plan for how to get through the winter, with an uptick in cases, right, with the Omicron variant and the unknown surrounding it. I saw it as 3 parts. 1, expanding access to testing, okay? 2, new travel restrictions to catch, anything that's incoming. And 3, expanding vaccine at, sites, access as well. So you talk about those 3, talk about what makes sense and what you think is still lacking.
So I agree with you. Even though a lot of the headlines right now are saying Biden's 5-part plan, I think you have to look at what changes are going to be made. Now, I agree that the push for these family vaccination clinics to help people who are on Medicare and Medicaid actually have access to boosters is extremely important. And they also need to be making sure that these town halls that President Biden announced and these education campaigns are also on the table, because there's still millions of Americans who haven't gotten vaccinated. So I'm glad that President Biden addressed this. Also, I'm glad that there was a big push in terms of keeping schools open while making sure that children have access, also huge. And testing, Kristen, testing has been something that we needed to be doing, have done more of since the very beginning of the pandemic. And, the conversation about testing is now coming back, where people are saying, hey, the PCRs can detect this new variant. The antigen test can as well. But guess what? They can also detect every other variant. And this is something people should be doing to know if they need to isolate, if they potentially are infected. Mm-hmm. The one little thing that I was kind of like, it kind of irked me is when there was that mention that home testing could be submitted for insurance reimbursement. I wish they were just free if you needed them.
Right. I was going to say, don't a lot of countries make them either free or subsidize it so that they're super cheap?
They do. I have friends, for example, in the United Kingdom who would send us pictures of the stockpile of antigen tests they had. Certain companies in the United States actually will give them away for free. So why isn't there a way to subsidize them for people who need them, or people, who in certain communities with a high rate of transmission, just get them for free? Because that's another step for people to have to submit for insurance.
Okay, but it's better than nothing. It's better than, I've been buying those Binax, at the stores for $25 and complaining about how expensive it is. And of course, a lot of people can't afford that. So, getting reimbursement is good, but that's only if you have insurance. What did he say about for folks who don't have insurance, how they could get tests?
I didn't hear how they could get tests, but they definitely did mention that people who don't have insurance could apply to get free tests. But as always, people who don't have insurance will still have access to clinics where they can get free testing as well. I just don't know what the option is going to be for people without insurance to get a home test to then get that cost covered. That wasn't clear to me if I didn't hear that detail. But Kristen, one other part that he talked about, which is important, is having those emergency response teams in the event that we see winter surges. Because remember, even those mild and moderate symptoms where people don't actually wind up in an ICU can still overwhelm an already busy and kind of very straddled healthcare system.
Totally. Okay, I want to talk about the other biggie today, right? And that's the travel component. The administration is now requiring incoming travelers from foreign countries not only to test, I guess they're shortening the test window, right? Before it was 3 days. You had to get a negative test taken 3 days before the flight. Now it's 1 day. Does that make a big difference? And do you foresee any logistical challenges with that?
Well, I think the logistical challenge offhand is going to be implementation. Let's see how we're actually going to be able to verify those and to verify and make sure that people are getting those tests. Are they going to be followed up on? Is there going to be, a quarantine period if you don't get testing? And what's going to be, and I don't want to put this out in the atmosphere, what's going to be the penalty if people don't do it? And that's different. We've heard all over the world where some people say you go to a specific center where they actually monitor you. You have to go through and get rapid tested before you get out and leave the airport. And I'm curious to see what that's going to actually look like. But in theory, this does make sense, especially if people are traveling to other countries and we are unsure of their vaccination status. It would be easier if we could just verify vaccination status prior to people getting on an airplane to once again show like, hey, there is a benefit to getting the vaccine.
Yeah, I don't know if you saw it because I poured over everything and I don't think they've spelled out exactly what kind of test would be accepted, right? So that is if I brought my Binax home kit, over to Europe, and when I come home 1 day before I take that test and submit the results, like a picture of my 2 negative tests, is that enough? Or do they need something that's, is it PCR? Do you have to go to specific labs? Are there specific partners? Do they say?
I have not heard this either.
Yeah.
And so, and I think this is important as we talk about the testing requirements, but also Biden's plan is that this is going to be fluid. And I think we're going to see a lot of changes as we learn more over the next few weeks about the Omicron variant, and also to look to see what vaccine uptake looks like in this country.
All right. One big component announced today, too, is the extension of the mask mandate on airplanes, trains, was going to expire in the middle of January, now through March. We're going to take a short break, and then we'll come back with another round of Two Truths and a Lie, where Dr. Alok Patel will try to get us and our viewers again. Meantime, you can join us on Facebook Live, and he'll answer your questions. All right, Dr. Patel, you're still there with me, right? I'm seeing commercial break, but I'm assuming you're still with us. I cannot hear you or see you, but I'm assuming everybody else can.
I can I can hear and see you.
Okay, great. Well, I'm seeing commercials, but at least I can hear you now, so that's okay. We can chat. Okay, I want to get to some viewer questions. So if you have one, ask Dr. Patel right now. See if we can find any. What about it? Oh, Dr. Patel, before we get to medical questions, our producer wanted to know about your experience on Kelly and Ryan on a national show. We launched you. Do you still remember who we are?
I can't give away all the fun details of the show because it'll be airing tomorrow. But listen, I respect the fact, similar to you, similar to the ABC7 family here, is that these conversations are done in a very casual style. So Ryan and Kelly bounce off each other in terms of the humor and then bringing it back to being serious and laughing again. And it's very appreciated. I also flashed my mug and got them both laughing on the show, which is always a win.
Your mug as in a mug you use, or your face? Because I don't want to call that laughable or anything. That would be really mean. Oh, the Hello Kitty mug.
I was gonna say, did you see the actual mug that made national on TV?
Oh, I didn't, but of course, Hello Kitty is adorable. How much time do we have in commercial break? We only have 40 seconds, so I don't know how many questions we can get to because we're so. Robert does have a comment though. Would be great to have free tests at airports. Agreed. 100% agree. There should be not only testing centers in airports, there should be vaccination as well. Yeah, right? All right. We're coming back in 20 seconds.
Thank you, Robert.
We are back with ABC7 News special correspondent Dr. Alok Patel. One quick question from a viewer before our second round of Two Truths and a Lie. Munisha wants to know, is there the possibility of travel restrictions for citizens where they will not be able to come back into the U.S.?
You know, this is a really tricky part, is that we can't actually predict what would happen in other countries. But as far as the United States, I have not heard of anything yet that would even indicate that we would bar citizens from coming back. Even with the travel restrictions in South Africa and the 7 countries around there was an asterisk for permanent residents of the United States and citizens. So haven't heard of that yet. But remember, if you have international travel planned in the next 6 weeks, you may want to just think about the fact that you may be quarantined in another country for a long period of time. They may say, hey, it's 2 weeks before you can do anything. And that might completely derail your plans. And that could change at a moment's notice.
All right, Dr. Patel, we are ready for round 2.
And I'm ready to possibly stump our smart viewers. Tell me which one of these is not true. Is it A, through affinity maturation, boosters can increase antibody quality and binding strength? Or is it B, the odds of dying from COVID-19 are 50% higher in red states, according to a new study that just came out? Or is it C, the FDA's Antimicrobial Drugs Advisory Committee voted 13-10 in favor of an emergency use authorization for Paxlovid? If you guys remember, that's the antiviral pill. Which one is false?
You know, I don't think I can comment about A, so I'm going to look at Facebook viewers' answers, but I do know that B is true. That is a study. I just saw it today. The odds of dying from COVID-19 are 50% higher, sadly, in red states. Okay, so it's between A and C. You know what? C feels like that feels right to me. I heard something about the Drug Advisory Committee's work and Paxlovid, is that how you say it? And I heard it was close. So I'm going to go with C, but before we lock that in as the final answer, quick look. Zion says C is the lie, but no, I think C is true. Okay, so normally I go with our viewers, but my gut says A is the lie. So I'm going to go with A, even though they're probably right and I'm probably wrong.
C is actually the lie. Our viewers.
They're so smart.
They are very smart.
Never
Listen,
bet against them.
It's molnupiravir. So, Paxlovid is actually the antiviral that Pfizer created, which actually has higher efficacy, according to the study, than molnupiravir, which is from Merck. And, the this committee just narrowly kind of voted in favor of it, citing some unknowns about safety, especially in pregnant women. So there's still some process to go through. It has to go through other parts of the FDA and the CDC before it's available to everyone. But I think the important thing here is like, yes, more treatments are going to be headed our way, not necessarily tomorrow, but still the best thing we can do is just prevent it from happening. And A is extremely important. And you know what, maybe I'll get to that afterwards in case we can talk from it. But you know, B just speaks to the politicization of the vaccines, which is very unfortunate.
Right.
And you know, even right now, there's these surveys coming out saying that, you know, there's still a large proportion of people who are Republican who either haven't gotten vaccinated or Republican leaders who won't disclose their vaccine status. And you know, Kristen, A, I think is a great segue for us because there's a lot of talks right now saying like, will the boosters actually matter? You know, do the boosters help? And there's some anecdotal evidence coming from Israel right now where their health minister said, hey, the boosters are protecting against Omicron. Now, I haven't seen specific data about that. That's reassuring. But affinity maturation is basically saying like after you get boosted and your antibody levels skyrocket, it's not necessarily the level. They become more robust at binding strength and binding a bigger variety of spike proteins.
So it's not just more, it's also better. That's an important point. I should not have missed that one. I'm really ashamed of myself. But hey, congratulations to Tessa, Karen, Robert, Dusty, Zion, and everyone, and Michael, and everybody else who got it. But no congrats for Kristen. Thank you, Dr. Patel. That was a good one. That was a good round.
I had to bring it. And those names those names that you just listed, they sound like the Avengers of epidemiology.
They really do. Okay, I want to talk a little bit about the Omicron variant and the latest that we know. I heard the second and third cases in the U.S. were announced today. Tell us briefly, of the first one, of course, being in San Francisco, announced yesterday. So tell us briefly what we know about those cases.
What we know so far is that, you know, resolving mild symptoms, both in the San Francisco case that was identified, the one in Minnesota as well. Now, what's interesting is what we mentioned earlier is the case in Minnesota. Both individuals were fully vaccinated, by the way. I have not heard of a booster status for the individual in Minnesota, and I don't believe the individual in San Francisco was boosted either. And, you know, the case in San Francisco, there was a history of travel to South Africa. In Minnesota, there wasn't. And if you remember, if we rewind back to, you know, when we had the first kind of community case of SARS-CoV-2 back in early 2020, that was the first time that there was no outside travel reported. And that's when everyone said, hey, it's officially here. So I think we can say Omicron is officially here. And, you know, the big question now is it going to outcompete Delta?
Right.
Because that's what it's going to need to do in order to kind of grip hold. The case in Colorado, there was some history of travel to South Africa as well. So 2 out of 3 have that travel history. What's important is I heard that the cases the contacts of San Francisco, there was no one around this individual tested positive, which is reassuring.
Okay. By the way, Dr. Patel, this is how quickly things change. The governor of New York just announced 5 cases of Omicron in New York State. So we're waiting to see if it's tied to that, you know, anime convention that the gentleman from Minnesota was at as well. But I'm glad they're doing the contact tracing, and I'm glad they're, you know, trying to nail this down. We're almost out of time, but I do want to ask you about this because part of President Biden's announcement today, he promised to help vaccinate the rest of the world at a quicker pace. Look, I understand about 56% of the world global population has gotten at least one shot, but there are big gaps between nations, right?
There's huge gaps right now, Kristen, and I'm glad that the announcement happened and that we finally are talking about sending vaccines over. The next part of the conversation, which should be all of the conversation, is helping with infrastructure distribution on the ground level in these countries, including fighting the misinformation, just to make sure that everyone out there, not only their countries are getting the supply, but they're able to go out and get one. Now, COVAX, the international alliance to get vaccines to developing countries, they had one of their biggest days ever, their biggest 24-hour periods ever, with 11 million vaccines given out. We're just hoping that we can continue that because guess what? All of the deficiencies in global vaccine equity is why we even got this variant to begin with.
Right, right. That's an important point. Dr. Alok Patel, always great talking with you. By the way, viewers are loving the Avengers reference, and this is why you're on Kelly and Ryan. And I can't wait for everybody to see you tomorrow, right? Tomorrow morning at 9 o'clock right here on ABC 7.
I'm here to represent ABC 7.
Excellent. All right. See you later, Dr. Patel. The annual Holiday Heroes event, helping Bay Area families, is back with surprises and stars. We'll have all the details next, including a special guest, the first female NFL coach. Yep, be right back. All right, everybody, we're going to take a short break. Admire a beautiful picture, not me, a beautiful outside picture, while we prepare for our next guest, and I can't wait for you to see.
Woo!
Hi, Jen.
Hello, Lovey.
How are you?
I was having fun reading about you earlier today.
Right back at you.
Holiday Heroes is returning to Oracle Park next week. The annual event brings surprises and stars together to help out hundreds of Bay Area kids and families. Joining us now is Amy Wenderhoek, president of the Wender Weiss Foundation for Children, and Dr. Jen Welter, the first female NFL coach and the co-recipient of this year's Inspiration Award from the Wender Weiss Foundation. Good afternoon, ladies. Good to see you.
Hi, Kristen.
Yay!
Hello, thanks for having us.
You don't know how exciting this is for me personally, too. You had to take a year off last year, but the most festive, heartwarming holiday event is back, and I know what I'm talking about because I have been there, and it is so great. Amy, what fun activities are offered this year?
Oh my gosh, we have so many fun things happening this year. And there you are. Sorry, I got distracted, Kristen.
Oski's always there too.
Yeah, we have snow globes, and we have cookie decorating, we have mascots, we have athletes. And what's super exciting is this year we have the bullpen, which just moved into the outfield. That'll be open and kids can go in and practice pitching. It's just going to be so fun.
Okay, I'm a little embarrassed. I'm going to tell my producer, take me off of there. We don't want to see me. But look, I am honored, though, to have been an advisory board member for you. I've seen the ways Holiday Heroes makes a difference in the lives of at-risk kids. Tell our viewers, though, how the kids and their families benefit from both the party and the funds raised.
Yes, what we try to do is we bring together all different members of the community, all different families, both families that can pay to attend as well as ones that are sponsored by our amazing donors. And they come and just have an unforgettable evening where they just can be kids and just have a really fun time and just not worry about anything at all. And then with funds raised, we do different projects within the community. We just built a fitness center in partnership with the 49ers Foundation in East Palo Alto, and we're refurbishing a basketball court with the Warriors in Chinatown. So we're creating permanent play structures where kids can be healthy and safe and have fun.
That is so awesome. And you always at the party have amazing sports heroes. One of them this year is Dr. Jen Welter, one of the Inspiration Award winners this year, along with 49ers legend Patrick Willis. Jen, you became the first female NFL coach when you coached preseason, I think, for the Arizona Cardinals, right, in 2015. But weren't you also a first as a player?
Yeah, so I was actually the first woman to play running back in men's pro football, and that led to the later coaching opportunities. So I played for 15 years in the women's game, got to represent the U.S. national team in 2010 and 13, then transitioned to the men's game first as a player and then as a coach.
Okay, can I just say how amazing that is, for all of it, but also because, like me, you are 5'2". 5'2".
Hey, small in
size.
I tell people all the time, like, in my mind, I'm XXL. In clothes, you just have to go ahead and get me a small.
Yeah, that's how I feel as well. I feel ya. Look, Jen, when everyone around you is saying, no, you can't, and no one who looks like you have been in that role before, how do you center yourself to keep chasing your dream and say to yourself, yes, I can? I mean, I want to hear that because you're going to be at an event with kids, and they're going to be looking up to you for how to, bring out the best in themselves. How do you do it?
I tell kids all the time, if I could do something at 5'2", you're probably already halfway there or more, right? And so I heard a lot of what I couldn't, shouldn't, and wouldn't do. The one thing that you can't do is let them be right. And one of the really cool books, things that the Wenderwise Foundation is providing is The Resilience, which is one of my book. And I think that's what a lot of it is that football teaches us it's not a question of if you're going to get hit, but when. And when you do, that's the choice you have. So how are you going to get back up and get better each time? And that's what I really want the kids to get, is that life isn't going to be perfect. It isn't easy. But if you prepare every day, just do little things every day to get closer and closer to your dreams, you'd be surprised just how far that can get you.
What a great message. Hold that book up again, Jen. Amy, I'm assuming that kids will get that book if they get the Wonder Box, or, you know, if they go to the event, it's in the goodie bag?
Yes. Yes, both if they get families order the Wonder Box or the Be a Hero box for our underserved kids, and then at the event, kids will get them as well.
Yay.
And Jen is going to be reading it too, so it's going to be super
fantastic.
exciting.
Okay, real quickly, we're almost out of time, but how are you making it COVID safe?
We're masking, we're outdoors. We are requiring 12 and older, everybody needs to be vaccinated. Under 12, one shot or a negative test within 72 hours or a rapid test within 24. So everybody 12 and older will need to be vaccinated, and as stated, masked, even though we're outdoors as well.
All right, so this is Tuesday, December 7th at Oracle Park. How do people get tickets?
Yep. They can go to our website, holidayheroes.org, and there are many, yes, that's the best, easiest way to get them. We still have a limited number left, and it's going to be super fun. And I think, you know, Kristen, Gabe Kapler, and National League Manager of the Year, is going to be there as well, doing a special appearance besides Sean Estes, who is receiving our Community Philanthropy Award besides Jen.
Okay, well. I wasn't sure if I could reveal that, if that was still a secret. That's great. Gabe, everybody loves Gabe.
I hope it wasn't.
You heard it here first.
All right, out there now.
Congratulations. We'll take a short break on the air, but let's continue the conversation over on our streaming platforms. All right, Amy and Jen, we are no longer on air, so that portion is over. You can take a deep breath. Woo! Great job, by the way. But we're still on Facebook Live, so we got a couple minutes here with our viewers. And I'm glad we started to show the party from years past that don't include me looking silly. No, I'm just kidding. But there's so many fun things, right? Because I know kids can, like, make cookies, decorate them, and there's always, like, Nutcracker, and, you know, there are those photos, baseball cards. And I know this year you're trying to move it outside, you know, for COVID safety. Will those things all still be happening, Amy?
They will still be happening. So we're really fortunate, assuming there's no rain, which there isn't at the moment in the forecast. We will be out on the field, but then also using the promenade level, which is the level right above the field. And it has both indoor and outdoor space. So basically one half of it is all open air and the rest is enclosed. So if there is weather, you'll still have a natural airflow. So we're still going to have all of our fun activities, snow globe decorating and cookie making, and you can make a bear. You know, the sky looks a little different, but we're just going to have everything still there. Photo trading cards. Stated earlier, Jen is going to do a reading, which is going to be so special.
Yeah, and can we take pictures? Can kids take pictures with Jen?
Oh, I sure hope so. I am in for as many pictures, as many cookie decoratings, face painting, whatever it is. Like, I'm in there. I'm a big kid. I'm actually not even that big. Most kids are taller than me by like 10 now.
5'2",
I am happy to like blend right in with all the kids and do all of the fun stuff with them. And then we do have some drills and skills too, right, Amy?
You're right. Thank you for mentioning that. So the 49ers are coming out, 49ers prep, and they're going to be doing drills and some clinics on the field. And Dr. Jen Welter has offered to be a part of it and help coach some of the kids.
Amazing.
So
ladies, guess what? We're out of time, but wenderwise.org. Get all the information on Holiday Heroes next Tuesday. Dr. Jen Welter, you're an inspiration. Amy, I'll see you later. And thank you so much for joining us on this interactive show, Getting Answers. Today, we cover President Biden's plan to slow down the Omicron variant and COVID-19. We'll be here every weekday at 3 on air and on live stream answering your questions. Be back at 4. Bye-bye.